Welcome, welcome everyone. Thank you for joining us tonight for our sickle cell awareness. Thank you for joining Caribbean Diaspora Vibes. We are so excited to have you here. We have a lot of information for you tonight. And tonight's episode is going to be hosted actually by Dr. Bavon Debrio. Hey, Dr. B, how are you?
Hey, good evening, everyone. Welcome back.
Welcome. Hey, Louie, how are you?
Greetings, how are you guys? Great.
I am wonderful. So everyone, you know me, I'm Donna Morgan, president of Caribbean American Diaspora, president of Women of Culture Incorporated, real estate broker at Florida Summer Homes Realty, and life coach at Inner Vibes Consulting. So I'm going to be turning it over to you tonight. We're going to be talking all about sickle cell anemia, and we hope that you just get a lot of information from our show tonight. God bless.
All right.
Good evening, listeners and viewers. We have a large panel this evening with a very, very special, lots of information, right, Mr. Lewis?
Yes, ma'am. Yes, ma'am. It's delighted. Welcome, everybody.
Thanks for having us, for taking this time, your busy Saturday evening, to spending this hour with us as we talk and educate our listeners and viewers about sickle cell disease or sickle cell anemia. People have different, we will get more as we go by, as the evening go along, with different guests telling us to spell whether it's SS, SC, and we learn a little bit of information as to exactly what they are. So at this time, we're gonna ask our first guest to come forward, and we have Dr. Tartania Brown, who's the senior palliative care physician. And she's also working at the MJHS Hospice and Pavilion Care out in New York. So welcome, Dr. Brown.
Hello. Welcome, everybody. And
joining us, you're in tune to Caribbean Rhythms Radio Network. And this is a live presentation with Caribbean Diaspora Vibes this evening.
Welcome, everyone.
Thank you, Louis.
Thank you. And I am also part of the Caribbean Diaspora. I have Trinidad and Caribbean heritage. Go Trini. Coming to you from New York, as stated earlier. And I am a physician, senior palliative care physician with MJHS, a hospice and palliative care group in non-for-profit in New York. I also am an advocate for sickle cell disease because not only is it very prevalent in my family, but it's also within me. I'm a patient with sickle cell disease. So I get to talk about sickle cell from the medical perspective as well as from the patient perspective. But I think because we have such a full panel, you guys might want to hear other patients, and I might just be giving the 101 on sickle cell disease from the medical point of view. So let's begin. So sickle cell disease is one of the most common genetic diseases worldwide. It is a disorder that affects people with genetic links to the African diaspora. So that includes people from the Middle East, the Mediterranean, Southeast Asia, Sub-Saharan Africa, the Americas, and the Caribbean. And in the umbrella of sickle cell disease, you have sickle cell disease hemoglobin SS, SC, sickle beta thal. So there's lots of different types of sickle cell subsets, but they all fall under sickle cell disease. And it is quite astonishing the numbers that exist on how prevalent the disease is, and yet it is so not heard of. Like it's not talked about enough. September is Sickle Cell Awareness Month. Thank you again for inviting us and for bringing a spotlight to this very important, very prevalent genetic disorder, because 1 out of every 365 Black or African American babies are born with sickle cell disease. And 1 out of every 16,000 Hispanic American babies are born with sickle cell disease. And what's even more amazing is that 1 in 13 African American or Black babies are born with the sickle cell trait, which is half of the full disease. So there are over 2 million people with sickle cell trait right here in the US that may or may not even know they have the trait. And those people can come together and make babies with sickle cell disease. And we'll get into the details of the difference between the disease and the trait. I first want to talk about what is the disease. So those of you who are viewing will see a very busy slide, but the way I like to break it down is donuts and bananas. I like to say that the genetic disorder, it affects our red blood cells. And what are our red blood cells? They are what carry the oxygen around throughout the body. We all know that we need oxygen to survive, but how does that oxygen work? How do we actually get it into our bodies? Well, with red blood cells, they are the powerhouse and the workhouse to get this oxygen all throughout our bodies. I like to say that red blood cells that are normal in other people look like donuts. They're nice and round, they have a hole in the middle, and you can say that the hole is kind of like where the oxygen lives. And they roll around nice and easy throughout the body, delivering their oxygen throughout. Well, persons with sickle cell disease have their red blood cells that look like bananas. And if you know, bananas have points on the end, so they don't roll so well. They also don't have a great center, so they don't carry oxygen. So a lot of times people refer to it sickle cell anemia because persons with sickle cell disease are chronically anemic. Their red blood cells always are breaking down and they're always trying to produce more because these bananas are very fragile. And as they go along in the body, they get stuck all throughout the body and they can cause traffic jams of other cells behind them. And then the oxygen, whatever little bit that they can carry, does not get to where it needs to go. And it causes these blockages and these pains. I had one patient say, it looks like a war going on. So it kind of does. Persons with sickle cell disease are called warriors because in their body, they're always having a war. So even though they may not be outwardly having symptoms of severe pain, because that's when all this war is going on all throughout the body and it's crescendo to a peak point where it's severe pain, there's also these little periods of lesser war where these blockages block and unblock all day, 365 days of the year. And that's what causes all of the different complications in the body. So because the red blood cells go all the way around the body, persons with sickle cell disease can have from head to toe complications, anything from strokes to heart problems, to kidney and lung problems. They can even have skin problems because again, the blood goes to the skin. Males and females, we don't even talk about, but you can have GYN issues and problems either carrying babies or carrying them to term. And then in males, they can have priapism, which is known as painful erections. And it's not even a sexual, it's medical and it's painful for the patients. And we just don't bring enough awareness to this. I can even say that in my family, my brother has a sickle cell disease and he had multiple strokes at the age of 4 years old. Sickle cell disease is the #1 cause of strokes in children. Genetic disorder that causes strokes in children. Children, how crazy is that? But why? It's because the red blood cells look like bananas due to this genetic abnormality, and it causes these problems. So I talked a little bit earlier about, well, what does it look like when a person getting to know that you have sickle cell disease means that you have both your mom and your dad gave you one each of the genes, and now you have one each, and so you have 2, and that's the sickle cell disease. But if you just got one gene from one of your parents and a normal healthy gene from the other parent, then you have what's called a trait. So you only have half of it, not the full blown. And then if you have one normal healthy sickle cell gene and another normal healthy sickle cell gene, then you have no medical problems pertaining to sickle cell at all. So persons with So two people that come together carrying one gene, so two people with a trait, each of their pregnancies can either give you a percentage of children with no disease, a percentage of children with the full-blown disease, and then a bigger percentage of children with the trait, half of the disease. That is the reason why the trait is so prevalent. 2 million people just here in the US. That's not even counting worldwide. So I was asked, because I know I don't have a lot of time and we have a lot of other people to get to, what are some common questions that people with sickle cell disease have? So can we explain what is newborn screening? So thankfully, in 1975, New York was the first state to mandate sickle cell disease be part of children that get screened for a panel of diseases, and sickle cell disease is on that panel. It takes a small drop of blood from the heel of the baby and tests for these diseases. And if your child comes up with sickle cell disease, you start to get connected to a sickle cell doctor, which is known as a hematologist. And then if your child comes up with sickle cell trait, you get informed of that as well, so you can inform your pediatrician. And then by 2014, all states are required to include sickle cell disease in part of their newborn screening panel. And it is important to know if persons have sickle cell disease and or sickle cell trait, because as I said before, the traits can pass on to your children. And then we can talk about, like, do people with sickle cell trait have any sort of medical problems? Well, back in the day, it was taught that persons with sickle cell trait are completely healthy and normal. But newer studies are finding that persons with sickle cell trait can indeed have pain and complications in the body, especially when placed under stress. It also can have these blockages. These are the same blockages that occur in sickle cell, but a lot less frequent because you don't have as many banana-shaped cells, sickle-shaped cells. You have a lot fewer of them. So it can occur, but a lot later in life and maybe not as severe. There are times where persons can get pain and then in their joints or their bodies, but they're in their teens or their 20s or even later in life. And people are like, oh, it's growing pains, or oh, it's arthritis, and they get dismissed. But in reality, it could be due to the trait. That persons with sickle cell trait can also have, similar to persons with sickle cell disease, have problems with kidney and with concentrating their urine. So they're also encouraged to drink a lot of fluid. So persons with sickle cell disease are always encouraged to drink a lot of fluid, as well as persons with sickle cell trait. And then children with the trait or the disease, as we talked about, it really depends on your genetic makeup from your family. What are some treatments for sickle cell disease? Well, when you have an infection, very similar to anyone else, you get treated for antibiotics. And persons with sickle cell disease, especially in childhood, it's found out that taking antibiotics consistently as a preventative measure really decreases infections. And that was a big cause of childhood death back in the day that we don't have now, because we know to manage and treat these things with antibiotics. We use pain relieving meds for the pain. There are 4 new FDA approved drugs for sickle cell, which is amazing, considering sickle cell disease was first described over 100 years ago in medical journals. And we're finally up to 4 medications that are FDA approved. Our first one didn't even start until 1998, good gravy. But it's been a long time coming, but we're here, amen. As I said earlier, hydration is important. Taking your vitamins, especially folic acid, which helps building your red blood cells, having a proper diet, and then avoiding extreme temperatures. Because if it's too hot, you get dehydrated. And if it's too cold, your blood vessels constrict, and it can cause a lot of the blockages even more frequently. Bone marrow blood transfusions can be treatments for some persons with sickle cell, as well as bone marrow transplants. And there's even experimental treatment such as gene therapy and a lot of research trials going on. And I encourage our community to participate in research, because if we're not there, they don't know how to treat us. The reason why we are able to get these drugs is because persons with sickle cell disease participated in research trials, and we're now all able to benefit. So if you know someone who has any disease, sickle cell or otherwise, encourage them to join the research trials so that we can get to the bottom and get proper treatment for our diseases. So getting back to the FDA approved, I know we're almost out of time. I see the sign, I'm coming, I'm almost there. No, we're okay, okay. I didn't really want to get into the names of the drugs. I'm not trying to promote one over the other, but I do want people to know they exist. I want people to know that there are daily tablet medications. There are powders that can be dissolved in liquid, and then you drink that daily or multiple times a day, depending on how many times you and the doctor prescribes it. There's medication that's monthly infusions, and that can be done in a clinic or a hospital. And I really, really encourage persons with sickle cell disease to go and talk to your specialist, not just the primary care doctor, but really your hematologist specialist about these new medications on the market. Yes, these medications can be expensive. And if you have insurance, wonderful. If you don't, the pharmaceutical companies that make these drugs are trying to work with the community. They are working with social workers and patient advocate groups to try to get the medication to where it's needed at discounted rates. The details, again, talk to your doctor, talk to your team, talk to the social workers that work at the clinics and facilities you go to. It is important to know that these drugs exist and that they do help with the complications of the disease, increasing your energies, decreasing significant pain episodes. So they have been shown to do a lot of good things. There's no exact cure in these medications, but you can live a happier, healthier life with these medications. So go find out. Now, the hallmark of sickle cell disease is severe pain crises. Oh goodness, known as vaso-occlusive crises. Now, these painful episodes are really where the rubber meets the road. It's really the point of contact for a lot of persons with sickle cell disease, touching and entering emergency medicine and hospitals. It's because of these painful episodes. But persons with sickle cell disease live with pain even when they're not at the highest crescendo of pain. They live their day-to-day with it. As I said earlier, these bananas rolling around the body get stuck and unstuck, and they can cause pain throughout. Just walking up some stairs, you can have some pain in the knees. So, persons with sickle cell can have damage to their nerves, their bones. So I did want people to know that there are different types of pain. Being a palliative care specialist, a lot of what we do is pain management. And we look at pain in a holistic way. Pain can be from muscles. Pain can be neuropathic, so the nerves are affected and damaged. Pain can be from the bones, which can be damaged again from the disease, complications of it. Pain can also be psychological. Psychological stressors do not get talked about enough in our community. Anxiety about when will you get sick again? Will this sickness cause me to lose time from school? Will this sickness cause me to lose time from work? Will this sickness cause me to pass away? All of these are anxiety provoking real problems that persons with sickle cell disease face, on a day-to-day basis. These psychological stressors are real. We all know that there are disparities in medicine. And I like to say that unfortunately, sickle cell disease is the poster child, the hallmark of all of these disparities, rolled up into one disease. Not only does it affect persons of the African diaspora, the hallmark is pain. And what pain means? Opiates for the most part, for muscle pain. And that really can be a psychological stressor that worsens the pain. Not only are you having physical pain, neurological pain, bone pain, but now you add psychological stressors or spiritual stressors on top of it, and that can enhance the pain. So each of those types of pain really should be managed and treated with different methods. Pain medication can range from opiates, which can be morphine or Dilaudid, to neuropathic medication to really address nerve pain, or even talking to a therapist, doing yoga, doing massage therapy. We underestimate the importance of touch and massage, holistically caring for the person, talking to them. Therapy is huge, like acknowledging that there are disparities, there are stressors in the life, and knowing that you're not alone, joining support groups. These are all ways to manage and mitigate pain, not just from the drug perspective, but globally. Persons always ask, well, what is the life expectancy of someone with sickle cell disease? And life expectancy is a number that has changed due to the research and the medical advancement and proper comprehensive care. Back in the day, even when I was born, it used to be till teenage. Then as I grew and we learned more, it became in the 20s and 30s. But now persons can live well beyond that, which is good for me because I want to stick around for a long time. I like to say, not questioning how little do I have, but how long and how productive can my life be with sickle cell disease? So it's not necessarily a limitation, it's just a part of you. I always used to worry about feeling different and wanting to be quote unquote normal like other people. And my dad always would say, you are my purple rose. Like, purple rose? Daddy, what? And so one day he finally explained to me why he always called me his purple rose. He says that you are a purple rose in a field of red roses. You are always looking out at the red roses, wishing to be one of the red roses. And all the red roses are looking at you, wishing to be purple, because you are unique and special in your own way. So I like to call all of my sickle cell warriors, whether you're fighting battles within your body or within the systems, you are all purple roses. And those with sickle cell traits, and you do have some pains, it might not necessarily be arthritis. It really might be sickle cell. That might have been dismissed as just arthritic growing pains. So knowing is half the battle. How can you help sickle cell? Join and support your community-based organizations. I'm part of a board I'm a board member of a local group here in New York called Candace Sickle Cell Fund. Big up to them. I also want to give a shout out to Sickle Cell Disease Association of America on a national level. They are doing amazing work promoting it on a grand scale and promoting it to the government and pushing bills. Ask your congressperson if they are aware and if they're supporting the Sickle Cell Disease Comprehensive Care Act, which is sponsored by Cory Booker. Its whole goal is to bring more money, awareness, sickle cell comprehensive centers, which we don't have enough of into the nation. And you can do as simple as talk to your family. Just stop putting a silence on this, a stigma on it. Just talk about it. I actually talked to a girl who is Jamaican and Jamaican descent, and she was like, oh, I think somebody in my family might have it, but she didn't know much about it. She didn't ask any questions. And I was like, ask, find out. You might be surprised with just how many people in your family have sickle cell trait and how important this is. 2 million people are out there, 1 in 13. So they're probably in your family. I know they're in mine. Thank you.
Dr. Brown, what a wonderful job. Very informative, very informative. And I know that our viewers would have the opportunity to look at the slides in previous, they will be there. So you can always go back and view. Mr. Wither, I don't know, when you said spiritual stressors, I can see some eyes popped open. So do you want to give us a quick example of that while I introduce the other guests and we move along?
Spiritual stressors can be, sometimes persons might be upset with God. Like, why did you create me? I'm created in the image and likeness if one is spiritual. And yet I have this disease that I'm born with. It's not something that you acquired. It's not something you didn't have good lifestyle. It's something that you were just born with. There's a genetic disease and change, and your cells are just different. Some people might have anger because of that. Some people, might not want to have any beliefs in higher powers. And those are stressors. Any of that you are working through emotionally, mentally, physically, spiritually, psychologically are all stressors that can worsen and enhance the pain of the disease and the complications of the disease.
Okay, thank you, Dr. Brown. I know that you had allotted this hour to spend with us, but I also know that you're busy, and hopefully you can stick around and we will have questions later and from our Facebook as well as people send in questions. Mr. Witter, would you like to give us a station ID at this point? It's halfway through. You're muted.
Absolutely, absolutely. We want to welcome everyone this evening to another edition of Caribbean Diaspora Vibes. We're talking about sickle cells this evening. We want to welcome all our panel discussion. And for those of you out there in Radio Land, keep it locked right here on Caribbean Rhythms Radio Network as we continue right here. Back to you, my dear.
Thank you, thank you. Okay, thank you, Dr. Brown. And we have Miss Carla Lewis with us. We also have Mr. Albert Robertson. And we also have special guests this evening. We have little Isaiah and Grandma, Miss Tara Parker. We'll be hearing from the others later. Okay, so at this time, we're gonna hear from Miss Carla. And Miss Carla Lewis is no stranger to us. She is always here when we need a hand to talk about sickle cell. And she is the CEO and founder of Kids Conquering Sickle Cell. And at this time, we'd like Miss Carla to come and tell us what it is that she does here locally and also abroad. Thank you, Miss Carla.
Thank you for having me. Yes, it's always a pleasure to come on the diaspora to talk and educate and just support. So thank you for having me.
Welcome back.
Also, thank you, Dr. Brown. That was a wonderful presentation, and thank you for providing that educational knowledge, sharing it with us today. I'm Carla Lewis, founder of Kids Conquering Sickle Cell. As Dr. DeBron said, I am a mom of a sickle cell warrior. I think that was one most important title for me. And my son is now a young adult living with sickle cell. So I started the foundation, pretty much the grassroots started as a support group in 2004. And we have now branched off to a nonprofit organization as of 2014. So it's been some time with our grassroots work in the community. We provide education, and that's sometimes through conferences. We do webinars. We also participate in health fairs and so much other things in order to educate. We provide awareness is another important factor of what we do, and advocacy. One of the things Dr. Brown had mentioned was a Sickle Cell Treatment Act, which is comprehensive act, which got launched this week, supported Dr. Cory Booker and others. So that is an important legislation that we also too know that comprehensive care is so important. And I'll talk more about that. And so With also doing advocacy, we also provide outreach services. So the families that need different things, may need a bus pass, may need support with paying a particular light bill. We're a small organization, but we have been doing things locally and nationally in order to help and support the community. We also have an international program called our One Love program, which we pretty much adopted Jamaica. As of now, we hope to expand in the future, but Jamaica is one of our support services that we've adopted to provide education and outreach. So we do a program where this is the second year we go out to Jamaica and actually have 2 sessions where we educate those living with sickle cell and thalassemia, and we pretty much educate the parents and also the providers, because sometimes it's different from the patient and caregiver aspect. So understanding from their point of view how they manage and what disparities that they may face and how they can bring it back to their peers in order to better understand and treat patients. So we provide educational outreaches, and also we provide health packets. And our health package sometimes is basically a support kit. We provide heating pads, as you know, when Dr. Brown mentioned that chronic pain, there's chronic pain and there's also acute pain that sometimes they have. And just a simple thing that a heating pad may also help when you were thinking about treatment for a milder pain. And then we also make sure we provide educational supplies. So we definitely have book bags and different items that they may also need. So we pretty much are in the community, hands-on, in the community, providing support in different ways. As I mentioned that my son, everyone thinks of kids conquering sickle cell, they may say, okay, they're focused on kids. We focus on the family, because I have a son that lives with sickle cell, and I can tell you, even from experience, it doesn't only impact him. It doesn't only impact me, but I have other children, and it also impacts them also, and our entire family unit, because when those hospitalizations started to get frequent, we needed a unity of support, and it had to come from everyone. Because I'm mom, I'm the one that's the nurtured one. It's going to be first to be there in the hospital and advocate for my son. But I also have my other children that also need that support when they also need mom around. So it took a lot. It took a unity of support. I can't say that the community itself ongoing is my support. I have mothers in the community. I talk to warriors in the community. I have a friend that's a mental health professional, and I too sometimes get my times where I'm like, this is so challenging. Right now, when Dr. Brown spoke about the disparities, and we have now 3 new treatments. We had hydroxyurea for years, over 20 years, and now we have 3 new treatments. And because of actually 2 of those treatments, my son has progressively been doing very well, living well with sickle cell, that I like to call it. So when we speak about treatments and progress, there's so much that I can say on that. And when she also spoke about one great thing, we have bone marrow transplant, which is a curative therapy that has been on the rise to show great outcomes. So they're still also doing research, but they've made much progress. And I see my friend Isaiah, which is here, which you'll hear more about curative therapy from an experience. So, and she also spoke about gene therapy, which is great that we have clinical trials available that is also showing great progress when it comes to curative therapies for sickle cell disease. So there's much progress that's coming along the way, I can say, from the time that my son was born in 2002. So we have seen so much progress. And one thing that I would like to say, because I know we have so much more speakers that will tune in on their experience, but I also would like to say, when we think about sickle cell, we have to also think about, what can we do? What can we do to help? And Dr. Brown mentioned so many things that we can do. Support your legislators that are making different laws in order to support sickle cell. I can't stress upon that enough. Support even our National Sickle Cell Association of America. They are doing great things. They have a conference coming up in October. Definitely, you can visit their website, which is sicklecelldisease.org, and definitely tune in to see what's the upcoming information and educational trends when it comes to sickle cell, as well as activities. And there are many, many organizations connected to that organizations that are doing some great things. And I also have to say one thing else is definitely, please donate blood. One of the treatments that is available for those living with sickle cell is blood transfusions, as mentioned, and we have blood exchanges. And I will say too, that is not only for those living with sickle cell, with those living with blood disorders, and sometimes in emergency situations. And I can't stress upon enough that when we speak about the trait, we always say, know your status. I really urge everyone to know their status, get tested. You just sometimes may never know. You know, not every country has the newborn screening in place. Like she mentioned, it came in place in New York first, and that was years ago. And it took time for the progress of others to come on board. So we still have people that don't know their status. And not only because of newborn screening, for some reason, sickle cell has not been talked about enough. So even when the children themselves have the traits, sometimes that information do not get passed on. So that educational information is so important for them to actually know that their testing status, what it was at the newborn screening, as well if there are a young adult or adult, just urged to get tested in order to know their status. Mentioning that when I said that my son was born with sickle cell, myself and my husband had sickle cell, actually diagnosed with sickle cell trait. I have with two different kinds of traits. He's thalassemia, I'm a sickle trait. So when she spoke about there's variation, so he's beta thalassemia 0. When he spoke about variations, sometimes you may have a trait and you don't know. And that was part of our family's status. I knew, he didn't know. And you know, when we come together and your family planning is not always the thing that we concentrate on when in marriage, right? To get tested and all those good things. And a lot of parents can honestly say that they don't know until they have a child with sickle cell. Does it change things? It may not change things, but moving forward, making an educated decision on care and looking at how you can best help your child and plan accordingly is so important. So I urge everyone to ask your doctor about the electrophoresis test in order to know your status. That is the test you want to ask for. So please, everyone, get to know your status and make sickle cell awareness a priority. We need to talk about it. We need to ask questions. I thank you for the diaspora having this, shining a light on sickle cell for Sickle Cell Awareness Month and beyond, because it's not the first time that they prompt the conversation on sickle cell. So I thank you for having me, and I look forward for increased education, because I'm always learning also. So thank you for having me, and continue to do the great things of bringing awareness to the community. And I'm Carla Lewis. You can find my information at kidsconqueringscd.org. That's our website, as well as you can find us on all the social media platforms. And for myself, again, you know, I'm on the platforms. So thank you for having me.
Good evening, Miss Lois. I can see the beams in your eyes, the enthusiastic. When you love what you do, you're just glowing as the words come out, and that is so meaningful to me as a sickle cell patient, and I could imagine to the others who are getting that knowledge firsthand from the individuals who are suffering, who are living or treating someone with sickle cell disease. You talked about getting the testing, and yes, you get the testing. Yes, you get the paperwork, like you said. And I remember back in the 80s when I had kids in New York and 90s. I guess I didn't have to get the testing because they know already my kids have the trait. But then I come down another generation where the grandkids got tested. They give you the sheet of paper saying you have the trait. 2 of them have the trait out of 5. Nothing else after that. You tell the doctor it's put in a folder. There is no follow-up. No, well, you can go to this treatment. So hearing it from us, I know that our listeners and viewers are definitely benefiting what we're saying or what we're bringing to them today, because they don't really tell you what's the next step. Like you're talking, or Dr. Brown mentioned early about your spouse and those things. When you're in love, you're in love.
Yes.
You're not doing that observation. You know, they just give you that, you file it, and it goes away until, whoops, something comes up, and here is another sickle cell baby. So it is also good, like you said, to check, to make sure that you expand your horizon, go beyond, find information, talk about it, and keep that light shining bright. Thank you so much, Miss Lois.
Thank you.
Again. Okay, I know you talked about blood transfusion, and you didn't give that little spiel about the putting up that placentas, the placenta that we can use. I know the doctor talked about earlier, Dr. Brown talked about genes, etc. But you usually tell us about that, because I know that is something that you share with your members.
Yes, I want to expand upon even we have a bone marrow registry.
We're going to get to that next.
And I want to prompt everyone that, you know, it's simple as just taking a Q-tip and seeing if you are a match. So we have Be the Match Foundation, Be the Match organization that also, you know, pretty much helps the match. And when we talk about minorities, that's why we're on please about donating blood and looking if you are a match, because you know that donating blood is saving lives. And I can say that I'm also a trait warrior, but I've also had a transfusion for emergency transfusion because of anemia, dealing with the having the sickle cell trait. So you know it impacts people at other stages, right? And we just don't know. And it's we need our minority community to step up and support in being that person that will donate blood and also being the match. And yes, when you spoke about making sure that you're well-informed and educated and enough in seeking the education, right? Because we all are learning. We continue to learn, but grasping to seek that education, to also share the information on the impact of sickle cell when especially it's in your family, right? You know, it's passing on to generations, and not to say the disease, but even the trait status, right? So it's definitely on to pass that information on. Yes, I thank you so much for sharing that.
All right, you're welcome. Thank you.
Carla, very good. You know, Miss Carla, I want to just really commend you. You know, there's a saying that God allowed things to happen to make things happen. And I think in your case, this is what happened. He allows your family to get sickle cell, you know, disease with you and your husband and your son. And you have really worked. You have really take what you know, what you have, what God allow you to have with your family, to spread it to the massive. And I really commend you for that, taking the baton and just really say, hey, listen, it's not just about me and my family. I'm going to prevent this thing from happening to anybody else. Or if anybody else happen to have it, I'm going to share my experience. And that is so commendable by you. I also want to also said that thanks for mentioning that people need to go and give blood. So important. And that's one of the things that our people don't do. We are afraid of giving our blood, and we have the best blood out there, folks. Listen, we as Black folks, or Caribbean folks, or African-American folks, you know that we have good blood, and so we should always love to give off ourselves. And I think I just want to commend you for what you're doing. Excellent job.
Thank you, Lois. Thank you so
Hello,
much.
hello.
Hi, Mr. Parker. Hello,
Mr. Robinson.
Mr. Robinson. Yes, sir.
Yes, I'm so sorry to interrupt, so rude and interrupt, but I was having problem getting on. So I just able to get on. I went to a friend's house because I was having problem with my internet. So no, I'm so happy that I am here to get all this information.
Thank you. You're welcome. Thank you. And sit tight. We'll hear from you after.
Welcome,
Okay.
Robinson.
Thank you. Thank you, Mr. Robinson.
Thank you.
Okay, next we have, I know Miss Carla, Miss Lois mentioned little Isaiah in the house this evening, and he is a product. He is a product of one of our treatments, which is the transplant. We also have Grandma, Miss Parker is here with us, right? Miss Tara, can you come on, or yes?
Hi, hello.
Okay,
I'm
good evening,
here.
good evening.
I'm just having a little trouble with my screen. It won't show, but it will let me talk.
No
And that's-
problem, no problem. Just so between you and Isaiah, just give us a little film of that transfusion, that bone marrow process that you guys had to undergo. And I don't think is it quite a year? He's at what date?
It will be a year, November 18th.
November 18th. God is good. So let's hear from you and then Isaiah.
Okay. Good evening, everyone. I am the mom of Isaiah. And as stated, he received a bone marrow transplant November 18th. I ended up being his donor. Originally it was supposed to be his older sister, but when they did the first round of blood work, she was the higher percentage of a match. And then when she came down in the end of October, we went in to do our blood panel. Well, she went in to do her blood panel work again, and as well as the other blood panels, which is where they do the genotype. And they've realized that I was an actually higher percentage than she was. So they called us on a Wednesday. He was supposed to check in that Monday. They called us on that Wednesday and they said, Miss Parker, we have good news and we have a little bit of bad news. So I'm thinking, oh God, we had already been delayed because of COVID for almost 2 years. So I'm thinking it's going to be a delay again. And that's when they explained, when we ran the blood panels again, it turns out that you were a higher percentage in the genotype match than his sister Sydney. So we're actually going to need you to be the donor, and so he can stay on track with checking in on Monday. Can you come into the office today so that we can do the second round of blood work? So after my kids picked me up off the floor, we got dressed. We jumped in the cab and we made it over to the clinic because he, prior to you checking for the transplant, there's a lot of follow-up testing that's done, well, pre-op testing. And he actually had an appointment at his regular hospital for scans to be done later on that day. So while we were in the cab heading to Aben Health, which is where he had his transplant done at, I called the sickle cell nurse coordinator at Arnold Palmer, and I let her know. And she said, okay, Ms. Parker, don't worry about it. We'll let the clinic know. You guys will be just coming in late. As soon as you finish, just let me know so I can tell them you're on the way. We did our blood work and they were, okay, yep, you're the match. So he checked in that Monday on November 8th. And you do, there's 9 days of what they call a chemo cocktail. There's 3 different kinds of chemo given to him, and that is to kill off everything before the transplant, and then you have 1 day of radiation. 4 days before, I had to take what's called a Nuprogen. I hope I'm pronouncing it correctly. There's shots to increase my bone marrow, and they make you feel like you have the flu, that you have been hit by a bus, pretty much. I later found out from the nurses that they said the worse you feel means the more additional bone marrow your body is making. So me not feeling good, when they would ask me, how are you feeling today, Miss Park? And I'd be like, I feel horrible. They were like, that's a plus, because that just means that your body is doing what it was supposed to be doing. And on the 17th, I checked in early in the morning and went in, and they were able to remove 2 full bags of bone marrow from myself. So God forbid if he would ever need to have another transplant, there's another whole bag being frozen at Advent Health Hospital for him. And I'll let him take it from there.
So yeah, pretty much everything before the 18th was like getting a whole bunch of testing done and making sure that I was ready. I went through the 10 days of chemo and radiation, which made me feel really sick. It kind of like killed my appetite. I wasn't really eating. I felt really icky. I was throwing up a lot. And I just felt really sick and worn out. And then when I eventually got the transplant on the 18th, it was pretty normal. It was really just like a blood transfusion that just takes way longer. And most of it I slept through, so I don't even really remember what all happened. But I woke up and I remember my nurses and my mom and my sister were there, and they said that the transplant went fine and they were just waiting, and they made sure to stay in the room and check on me and make sure I didn't have any like fevers or anything to mess with my body, any kind of symptoms. And everything pretty much went fine. And a few hours later, they told me that I was medically sickle cell free. And that was it. For the rest of the time, I just spent my time at the hospital just rebuilding my body, pretty much trying to get my appetite back, making sure I wasn't still sick anymore. I just after that I was just taking like like meds to stop infection and stuff, make sure I wasn't gonna get sick from anything. But it was a really just tiring process. Wasn't really anything too bad about it. I would definitely say it was a good experience to have, and I would definitely tell anyone who's suffering the same thing that I was that it's a good opportunity and it's a great idea to at least talk with your doctors and family about it, because it opened up so much new opportunity.
Okay. So, Mr. Isaiah, this was in the heart of COVID a year ago. And I remember we had a line that we were praying on, and we were just giving information, and mom would say, oh, you know, COVID and this and that. What was your mind? Where were you? Mentally, where were you?
It was stressful because you know, we had got a date, like we originally were planned to go like back in 2020, like mid 2020, and COVID hit and pushed it back, of course. And that was a little bit stressful, kind of, you know, killed my spirits a little bit. But my doctors, they were saying that, you know, I'm still gonna be able to get it. It's just that they have to push it back because other kids need it more. And I was fine with that. I originally was, you know, a little bummed out because I had to wait, but realizing that I was still gonna get it anyways. I just had to wait a little bit longer. I was fine with that because waiting a little bit longer wasn't any kind of problem for me because I've been dealing with this for pretty much my whole life, you know. Waiting a little bit more to not have to deal with it anymore I was definitely fine with it.
Yes, yes. And waiting a little bit longer also gave you that opportunity for you to get that stronger match, right? Because now you had mom who was able to do instead of your sister. So that's also an opportunity. So to give you mom is a better match. So that resistance, your body fighting against it, maybe with your sister, you know, that opportunity was just awesome, you know? So maybe that was the wait as well. That was the wait. You never know. A setback, 2 steps forward. Mom was able to get 2 bags of blood, 2 bags of marrow, and we have reserve. So, you know, it's just the work. It's just the work in progress. That is just a story, you know. It is a story.
Hi.
Go ahead, Miss Parker.
I just wanted to mention, it was a screening process that he actually went through. So it was started out with about 50 kids, and then they screened that down to a smaller list because it is still considered experimental in the state of Florida. So they wanted to make sure the kids who received it that their bodies would be able to sustain what they had to go through. And when COVID hit, they had to shut everything down for a while because they didn't know how COVID, if a child coming in who may have it, or they weren't exactly sure how they would deal with it. So that was also part of the reason why it was delayed. Once things had got started back, thankfully, he was not as sick as some of the other children on the list who were approved. So that was also part of the reason why we got a little bit delayed, which was a little heartbreaking, but I understood because there were children who had strokes and had other issues that were going on. And thankfully, Isaiah hadn't gotten to that level yet. So we were all a little bummed, but we were grateful. I managed to keep him COVID free, which was also a weird thing to do. And also because COVID was still going on when he had it done, I was really the only person and one aunt who was able to really see him in the hospital. So it was kind of harder on that because we were used to at least having that support system to be able to step in and sit with him for a little while. But as far as the matching for the bone marrow, he was lucky. He was one of the few lucky children because they tested myself and his 2 sisters. All of us were actually matches. So the doctor told us that she had been doing these surgeries for a few years. Just recently, within the last 4 to 5 years with sickle cell patients, we were the first family she had where there was more than one sibling that matched, especially with a half sibling. So the bone marrow registry is of utmost importance for us because they would prefer to get the match from the same background. There's something about our blood that nobody else can reproduce. And he, as I said, he was lucky because there was a child that was supposed to go in after him and they could not find a match in time. And they had to go through the registry, which takes a little longer. So we're grateful that things kind of fell into place. And so far he's been great. He's back to his normal self. He's still in a little bit of a bubble because there's COVID and now monkeypox. So his interaction outside of the house is still somewhat limited. But he's doing well as far as recovery.
You're muted, Dr. Bev.
Thank you so much, Ms. Parker and Isaiah, for sharing that experience with us, because a lot of people hear about that new treatment or that transplant, but to actually hear from someone who have experienced it, that is definitely a blessing to our viewers and listeners. I know it definitely touched me, so I can just imagine. And we're glad that you're doing well, and I hope that 1 year we can have that celebration in November on the 18th. We could have that 1 year celebration and just kick everything. I'm living with SS, and I'm doing blessed. You know, to hear your stories, just miraculous. So thank you so much. Thank you guys for visiting, and you guys won't be a stranger now. Right, Miss Lewis? All right, so we have one more special guest we have here, Mr. Robertson. And Mr. Robertson is a radio host, and he's gonna talk to us a little bit, do his spiel. Mr. Robertson, are you ready?
We did mute him earlier, so Albert, if you can unmute, we had to mute you earlier when there was some background noise.
I sent the message. Mr. Robinson, you can unmute.
He's trying to have someone to help him to unmute. There you go.
Okay, first, I just want to say I'm so sorry that I came on late. And I just want to commend each and every one of you that take time out.
Excuse me, Mr. Robinson, you can leave the phone right there and we can hear you just fine. So just,
okay.
Yeah, we can see you. There you go.
Okay, so I was just saying that I just want to commend each and every one of you for taking time out for those valuable information. I am the father of a sickle cell child. Well, now he's a grown man. And over the years, the experience that I have as a parent, I just want to share it. And we feel the pain just as much as the patient feel the pain. And I know most, if not all parents can attest to that we suffer the pain. I spoke to a sickle cell patient once. She's a friend of my son. And we met her in the hospital. She was hospitalized. And she said she have 2 children. And the pain of a sickle cell person, the pain of a mother giving birth to a child is nothing compared to the pain of sickle cell. So you must just know how devastating the pain is for the people who have sickle cell. But one of the things that we do in New York, and in 2009, I put together an organization by the name of New York Community Alliance for Sickle Cell Anemia, after I see the suffering of people with sickle cell. And one of the things that I really, really pay attention to is the support of parents. And we had a support group, and we would meet like once a month, and we would call one another and find how you're doing. And we would go and spend some time with the patient who is in the hospital to help to take some strain off the parent, because sitting down, one of the worst things could happen as a parent and see your loved one suffering and there's nothing that you can do. It is so hard. I am not ashamed to tell you that one day that I saw my son was going through this pain, and he turned to me and said, "Dad, why me? Why me? I wish I would die." And believe you me, people, that really hit my nerves. I went into the bathroom because I didn't want him to see me crying, and wet up my face and come back and talking to him, try to encourage him and say, God is on your side, things gonna be better and everything. But when he told me that, it hit me very, very hard. So I would say one of the greatest things is to support one another with sickle cell. Another wonderful woman in New York named Miss Rochester. Many of you may know her, Miss Rochester, and she's doing some marvelous job up there in New York with the supporting of parent and family with family member with sickle cell. I don't have much to say because I don't really have much voice tonight, but I'm so happy that I was able to come and to hear what I hear. And I would like to ask some questions. Is there any cure for sickle cell at this minute? And if not, how far are we from?
This is Carla Lewis, and I'm just going to chime in real quick. So we have no universal cure for sickle cell, but there are curative therapies such as gene therapy, and we have bone marrow transplant, and we know gene editing is another therapeutic curative therapy that's on its way. They've seen great progress, and it's come a long way. And I would say when we had a time where a lot of just like still it's still in the clinical stage, even though it's getting approved by certain insurance as far as Medicaid, able to approve bone marrow transplant. Then we're not there with gene therapy, we're not there with gene editing, but at least this is a curative therapy that some are having progress with. We know that there are going to be challenges because it's still under a study. There's still some challenges. They are looking at certain things, but we've seen some progress. Those patients, just like Isaiah spoke and said, look how he's doing, and they can go back and now say he has sickle cell disease at the components of being SS, but he's cured of sickle cell disease. So no matter what, he still has the two genes that he has to be very careful in order to, as far as family planning, but as far as him fighting sickle cell, that has gone away. That chapter in his life has gone away. So there's great progress. Another thing that I will also say is that the challenges prior to a patient having either any kind of curative therapy, whether you had damage with the lungs or damage with the heart and neurosis of the hip, because we know that sickle cell affects the bones. Even that damage doesn't go away, but sickle cell goes away. So that the progress of, and we speak on, I have to say this, a lot of times we speak on the progress of pain, right? Because that is the hallmark of the disease, but there's silent damage that's occurring inside the body. That's why these curative therapies and medications, in order to oxygenate the blood, is so important. So we're not there yet with 100% cure, a universal cure, but I feel that the cure is in the making, right? I really feel it's in the making, and we've seen great progress with our curative therapies so far. So that's a good chapter. It doesn't work for everyone, and also everyone does not qualify because there are guidelines. If you've been too sick on a spectrum of age also that you cannot have, there's risk factors that they may not be a candidate for these curative therapies. But therefore, we know that, I have to say, there's more medications on the rise, and we see progress that this is being supported. So I can see in the future we'll have more FDA medications, and hopefully that cure is on the rise.
Thank you so much, Carla. This is Uncle John, just in case you don't know, recognize. This is Uncle John.
I can't never forget you.
Okay, so Carla, and to others, this month is Sickle Cell Awareness Month, and every day I have information that goes out on the radio. So if there's anyone having a time, they could give me a call, and we could arrange that they could come on to the radio, come on the radio, and give some information. They don't have to come to the radio station. They can just wherever they are, they can talk with me over the phone, and it goes straight through the radio.
All right. Thank
Is
you
it okay
so
if
much.
I just wanted to add to what Carla had said.
Yes.
As far as the cures, Isaiah's 20. When he was born, I was told that there's no cure and there's no real medicine besides pain medication to help treat him. When he turned 5, we had heard about the first transplant for a sickle cell patient. And at that time, it had to come from a sibling, a full sibling.
Yes.
So in the span of 15 years, they're now able to do transplants with strangers, from a stranger donating bone marrow to a sickle cell patient. To me, that's a big progress, because I never thought of him being considered medically cured. But yes, the progress has been slow. Thankfully, our community, although we're small, we've made a lot of noise, and we have medicines that are out there. Before surgery, he was on 2 medications that helped him. The hard thing with sickle cell is what works for one person may not work for the other. So it is a lot of trial and error. And I think that's also a part that we have to get our community to understand. Try it first for a while, for more than a month or 2. Try it for a couple of months, because sometimes it does take your body a while to get used to the medicine, and it has to be adjusted as well. I do think that we will have a cure that can work for everyone. I do see that coming in our future, so that we don't have to worry about a child being in pain and dying from a stroke at the age of 5. I just feel it in my bones that'll be there. And in the meantime, we're gonna hold on, and we're gonna rally around to make sure that the medicines that are available, that our community knows about it. Because during his process, me personally, I found a couple of parents who had no clue about sickle cell medication. So I gave them information to take to their doctors. But I do feel that a cure will be that will be able to say, yes, our child was cured by this, and that won't be as an issue anymore.
Thank you, Ms. Parker. And that is so true. You said when he was 5 and now he's 20. And I remember the doctor also mentioned earlier, and I know that at 8 years old, when I found out, they said I would live till 12. So that's teenage, like the doctor said earlier. And then as Rigord says, 20s. And then thank God we're still here. Amen. So like you said, how come we're closer to a cure? And I do support and believe that is because the doctors didn't know about sickle cell. They didn't know. They couldn't help something that they had no knowledge about. So now that we're given the education, they're dealing with the experiences more, they're coming closer and closer, and we will get there. We will get there.
Quick question. Is this process covered that Isaiah went through? Is it covered by insurance, or is this out of pocket?
He had Medicaid.
Okay.
And that was part of the screening process because the state was paying for it. So they wanted to make sure that the people who are receiving this gift of life, I call it, would be successful, and it would be for the betterment of their life. It even with that covering, it's still out of pocket expenses that they don't cover. We chose to have his sperm frozen. Insurance does not cover that.
Right.
I was fortunate enough to work the place that we chose. They worked with us and they did give me a referral to a company that helped with some of the costs, but not with all of it. The sad part is that if he was a child who had cancer and was receiving the bone marrow because of to cure his cancer, that his Medicaid would have covered.
Yes.
Yeah.
Yes.
So that is something that I would like to work on, because I think it's unfair. We were lucky. I mentioned it in passing to a church member, and she's working with me because it's a monthly fee. So she's working with me to get something set up, but not every family who's going through that has that option.
And that's something we can petition our government officials with, Ms. Parker. That is definitely true, especially when hydroxyurea is a treatment, and we go to the cancer center, we go to the hematologist, we take hydroxyurea, you're losing your hair, you're going through the same process as those with the cancer. So it's the same thing. We should be allowed those privileges as well.
And the clinic that we chose, the receptionist there, she was like, I don't understand, the insurance won't cover it. And I explained to her what they said to me, and she was like, that is ridiculous, because you guys are literally going through the same thing as a cancer patient goes through. So there's a bias there. And I'm sure that since more people are being afforded the opportunity to have this procedure done, we'll get some noise made behind that, and that'll be changed.
Definitely. Thank
Is there
you guys so much.
anything on the books, Carla? And
I just want to chime in. With insurance, it's always on a case-to-case basis, but Medicaid will cover, and it always is the mileage you live from which facility that does that transplant, and it has to do with how much things that even the hospital may have grants that can cover, whether it's that because within a transplant you have a month that you shouldn't be around anyone, and they told pretty much myself when my son went for screening, he will not be able to go home. So that option, how will you be able to afford that and what they will do? But these facilities, it depends on where we'll have these grants and things. Now, private insurance on a case-to-case basis will, they can look at covering a bone marrow transplant. And just like you said, if it's on a clinical trial, now that's a little different. They will cover that procedure. But I also was told like the aftercare, the post-care may not be all 100% covered, or it's to a certain time. So there's still some gaps to work with, but there are, we're looking at progress. And what she mentioned when we said the reproductive health, that is priority that we need to tackle with legislation. There is no way that in this day and time that when you go through such a harsh process, having a bone marrow transplant, and even with gene therapy, we need to have the support of reproductive health for our young men and young women. That process is not covered by insurance, but looking at different gaps, there are places that will work with you on some half. Now we have the sickle cell reproductive health, which I'm also an educator on that platform. They have different quarterly educational series, and they're now able to provide, and one of the founders is Tiana Wolford, and she's based in Baltimore, and they're able to provide grants now. They have about 10. I mean, it's a small minimum because they're a new foundation that's starting, but they had executed to afford to account for at least 10, the help 10 families that want to have fertility preservation. That's so important because when they go for these treatments, these curative treatments, sometimes they're definitely they lose that, they may lose that ability to reproduce, and that we don't really want that, right? But we need to be able to help that process, that they have an option to save their eggs, or save their, be able to save go through the sperm bank, right? And also, I really want to say this, because when we talk about education, I want to say that those that have had a child or that is pregnant with a child after they've had the child with sickle cell, you're able to save your umbilical cord. There's a bank that's called Viacord. They will save it for free. And I did that with my child. So my last son, I saved his, I banked his cord, and I was able to save it. They saved it for a couple months. It was 5 years for free, and then you had to pay. But they had changed that and then made it being able to have it accessibly free on. So definitely you can save your umbilical cord for further research and possibly for that bone marrow transplant. Now, my son is now 20 years old. We did go for we did go through the process of finding out who's a match, because he has other siblings. My last son is actually a match for him. So he's blessed to have a match. Now it's up to him to make that decision of will he want to go through the process to have this curative therapy, because there are complications that they do discuss that can happen. One of the risk factors, it may not work out. It may go for rejection, and that has happened to some. There's complications, but you have to think positive to say, if I'm a candidate, can I go through this in a healthy way? So that's a decision he has to make now. But it's great that he does also have the umbilical cord saved through Viacord, that they also would like to pull that and see, would that be a better chance of him going through that process of research? Now, because it's still new, right? Because it's still new, even using the umbilical cord, they will be able to try to figure it out once he makes that decision. But I tell that to parents that know that you do have that option. Definitely, I would say bank your cord. Research is on the rise, and we want to see more curative therapy. And if not for yourself, save that cord. They can use it in some testing. They can definitely use it in experimental, because this is a learning chapter in these years when it comes to sickle cell. So our advocacy makes a difference.
Yes, thank you.
Thank you, Ms. Carla.
We are learning so much. Every time you guys come on, it sounds like we need a meeting with our local legislators, Carla, to bring this topic up.
So we've had some great support in the community, and I will say this, I have met with a lot of our legislative awesome, but that things have now changed. We're in a voting season, and this is a great time to make our voice be heard. Every year we go with the rare disease community, and we meet with our even local and our federal supporters that are for sickle cell. Like I said, that new comprehensive act that have just been introduced this week, that is so important. And we'll be doing a talk on that, myself and Matt Pelor. We'll be doing a talk on that this month on Monday, the 26th, talking about that new comprehensive act that's coming forth. We're calling for a plan of action, a call of action for everyone to meet with their representatives and talk about and how important it is. Can I say this? One of the things that's so important about this when we come to comprehensive care, because sickle cell affects you from the brain all the way to your feet, right? And the problem is that when our children become adults, they don't have the system that's supporting the comprehensive care. So therefore, we also have a community that's not getting the needed health care, and there is an increase of premature deaths with our young adults. This is why the comprehensive care is so important, even for our young adult community to be supportive. We know that there is a lack of physicians, hematologists, particularly, that are specialized in treating sickle cell disease. And so there's a call to action, even too, for those that have interest, because Governor Charlie Crist have also introduced an act, I want to say it was a couple months ago, the beginning of the year, that is supporting for treatment centers. So there are some things in the works coming up for sickle cell, but we needed to see supported, because I'm noticing one thing: it'll get introduced, and we've had great success in the community, but particularly in Florida, it'll get introduced and then it doesn't go forward. And we need our federal support. We need our local supportive acts to move forward. So definitely we do need to visit and attend town hall meetings of our legislators and support them, because we need their support also.
Right, like Ms. Carla is saying, we need to stay visible, because a lot of times we win a little bit and we just let it go. We have to hold on and keep that fight real. You have to be consistent, okay? So that is what we need, our viewers and our listeners to be consistent. Mr. Robinson, thank you for asking us, or to giving us that opportunity for to spread in sickle cell more by coming on air later on this month. Anytime that we are available to our listeners or viewers, anyone who would like to share about sickle cell awareness this month, please touch base with Mr. Robertson. Mr. Robertson, is there information you would like to give? Contact information, please.
Oh, yes, with our pleasure. My number you can reach me is 347-264-7158. My email, robinsonalbert46@yahoo.com. I will repeat the telephone number real quick again. 347-264-7158. I have a quick question though. I can't leave without asking this quick question. Anybody can address this to me. I noticed over the years, they had made some stride with the children who have sickle cell. But for the young adult, like Carla was talking about a while ago, we noticed that there some negligence, or I don't know what word to use, but there's not as much stride made with the young adults like the children. Can you tell me the reason why this happened?
Okay, Ms. Carla will answer, but I'm gonna say it's just like with anything else. When you become a young adult, you're more carefree. I went through the same process where I had to eat certain things, but as you're younger, you didn't understand the importance, right? Remember, as a child, your parents is doing it all. They're carrying in the load. You don't get to feel and understand. When you become 18, I heard Carla say her son has to make that decision because he's now an adult. Isaiah, they have to make these decisions on their own. So my decision was to hide certain food off the plate and trade it with my aunts and do these things as a young adult, right? That conscious level. As you got older, you start to realize, wow, I can do this and it works, and this and it works. And I know Dr. Brown mentioned about the weather and stuff like that. It's just, you are getting better as time goes. And that's the same thing as in anything else with teenagers or young adults. You're carefree, whatever the doctor say, oh, please, you don't really feel it for yourself until you get to a certain age. Then it kicks in that I'm in control. I'm the one who's going to decide whether I live or die. I got to make some real serious changes. Getting diabetes, getting any other thing, you've got to make that change. Starts with you. Consciousness, being aware, being educated, and making that change. That action step has to come from within.
Thank you.
Dr. Bevan said it all. Thank you so much. She's on point. When you become an adult, you are responsible. The parent have done the job of taking you to the clinic and making sure you see the eye doctor, making sure you see the hematologist, making sure you see nephrologist, making sure you go to the ER when you need to. we also have a disparity in the community, and there is bias, and that also impacts the patient. Now, as a child, remember that care came from a unit of love. Do not want the child to feel pain, or being able to be making sure that child is very well cared for. Now, as adult, the system is a little bit different. They're expected to know how to manage their pain, right? They're expected to deal with the pain at times, and they're sometimes being able to access medication when they go to the ER, because they're not seeing their hematologist like they should on a regular basis. They're missing appointments because of choices, and sometimes being able to adapt to the ER care as their primary care, which is a problem in the system, and it's also a financial burden on on our healthcare system. Because of that, sometimes there are problems even getting access to the medication, and being seen as a drug seeker. All of this plays into the part of care. So partly it's the patient, have to be responsible for their care and being able to navigate the healthcare system, and also the healthcare system being supportive to make sure that young adult gets the care that's needed. And we see the care changes. The hospitals for pediatrics are beautiful. They're colorful. When you go in, it's like almost trying to immediately get you in. Now you can talk to a sickle cell adult patient and they can tell you that they've waited 8 hours to be even seen in the ER. It's a problem. That's why we as advocates have so much work to do. We've come a long way. So just know that there's work in progress, and there's still more work to be done, and it will get done. So we continue to love our legislators that support sickle cell advancements and access to care and treatment, because this is the way that we get the progress done. We're gonna get this work done for our community.
Thank you so much. I want to thank all our listeners, our viewers, and our participants this evening. Ms. Henry, I saw you in the background. We want to thank our radio host, Mr. Louis Guido, who stepped away for a minute, and CRR Radio Rhythm Network, for the Caribbean Radio Rhythm Network, for listening. Staying tuned with us on a weekly basis. On this night, it was such a powerful evening that we went over 30 minutes. So we got to bring it to a close. Thanks to everyone. And this is the next step. Legislative needs to come aboard. So thanks, Isaiah, Ms. Parker, Mr. Robertson, and all our viewers and listeners. Have a blessed and wonderful Saturday evening.
Thank you.
Bye.
Good night.
Good night. Good night.
Good night.
Good night.
Good night. Merita.